Breast augmentation is a big topic, whether you're, looking to enhance what you have or after you've had a family or children, or even for reduction. Do you find that more people are inquiring who are in the later spectrum of the boomer population about that, or is that something that's a little bit still younger?
No, the later spectrum of the boomers would be more biased towards considering breast reduction type procedures.
Okay.
Especially, I have a couple of patients who I've treated who are, well, in their early 50s. They're very athletic, they're into sports, but they've had chronic back pain, neck discomfort from just enlarged breasts, and those patients who've had breast reductions do well. They're some of our happiest patients because they're able to enjoy sports without pain, and it's really a liberating experience for those patients. There's some of the happiest patients that we have. On the other end of the spectrum, the younger boomers, maybe early mid-40s. The early mid-40s, maybe not even baby boomer generation, as we were talking about before. It's more of like the older Xers. But anyway, those patients that have just completed childbirth and they had some deflational changes in their breast, they're not looking to be really large. They kind of want to get back to their baseline, or maybe be a little bit bigger so that they just look better in clothing. Bathing suits look nicer. Those patients tend to consider augmentation. Those are some of our happiest patients too, because they're mature, they understand what they want, and they're realistic about their goals.
How do you handle, I've always had this question, how do you handle having mammograms if you've had breast augmentation? Is it still pretty, status quo routine?
You can do it, sure. Well, I mean, obviously you have to let your mammographer know that you have breast implants, and there's special techniques that are utilized to image the breasts when implants are in place. And if there's any question about imaging with standard mammography, then MRI can always be utilized to image the breasts.
Very good. What about tummy tucks? That's another one that's a pretty popular procedure. What's new with that?
I would say that I don't know if there's a lot new. What I can tell you is that we encourage patients who've had tummy tucks. We counsel them not only about the surgery, but about diet and lifestyle changes. I mean, it's all part of the wellness or anti-aging cycle. I think the important thing about patients who come in for tummy tucks, it's not like, well, I'm going to do a tummy tuck in lieu of diet and exercise or better lifestyle. Those patients come in because there are simply things that can't be improved in the gym. Loose skin, muscles that have been stretched by pregnancy, that's just not going to get better. You can always lose weight, you can always lose fat with diet and exercise, but a lot of times that doesn't help the appearance of the abdomen enough. So we can help patients surgically with things that can't be fixed with exercise. And then once we've done that, they'll use it sort of as a springboard for overall better health and wellness, because patients see an immediate change and they're very motivated then to maintain it.
Oh, absolutely.
So it's a big motivator for a lot of patients. But as far as what's new, not a lot of new actual techniques per se. I think maybe what we're seeing now that bariatric surgery is on the rise is a lot of patients with just massive amounts of excess skin.
Sure.
And so I think in a sense the field of body contouring has changed a lot because of the rise in bariatric surgery, because the procedures that are needed are more advanced, they're more time consuming, and involve removing a lot of skin. And so there's lots of new techniques for body contouring in the massive weight loss patients. That's almost becoming a subspecialty unto itself within plastic surgery. There are whole fellowships dedicated to just massive weight loss plastic surgery. If you can imagine.
I can imagine, yeah. I mean, it seems that, with, more and more people, we had a bit of an obesity epidemic, and more people are really taking that very seriously and making those lifestyle changes and taking care of that. So what better to, complement the hard work you've done and then gone through surgeries like that than to go ahead and, take care of the external part of it as well.
The journey is not complete for these weight loss patients until the skin has been treated.
Oh, yeah.
There's no doubt.
What about products? I know that a lot of folks are, really believe that the basis of, not getting wrinkles and defying the aging process is good products. What's your take on products and skincare?
Products and skincare are really important. We encourage patients certainly to use sunscreen and to consider chemical exfoliation of the face with vitamin A products. Using skincare as an adjunct to traditional facial surgery is important, and it improves your results and increases the longevity of the surgical procedure. As far as, I guess an analogy would be that if you're having a surgical facial procedure such as a facelift or a tailoring operation, then you would also want to consider dry cleaning your new suit, in a sense. You think about it that way. That's skincare, that's dry cleaning, whereas the surgical portion of the procedure is tailoring.
Sure.
So skincare is important for skin rejuvenation. And I would say that we have several estheticians that work in our practice that counsel patients about skincare both pre and post operatively. But the cornerstone of good skincare is sunscreen and chemical exfoliation with retin A. But there are also topical antioxidants that you can use on the skin that contain vitamin C and E. Those are important as, and can reverse some of the sun damage that's occurred over the years.
Yes.
So it is
Sunscreen
very important. It is
the number one thing to do, right? The takeaway.
It is, and we try to take a multi-dimensional approach to facial rejuvenation and plastic surgery. It's really just not enough to do a facelift anymore. You really need to counsel patients about skin care and skin rejuvenation, and it really maximizes results and increases the longevity overall of the procedures.
Absolutely. How about, we've talked a lot about things that the ladies might be interested in. What about men? Do you see more male patients these days? Is that a part of the trend with maybe some of the boomers?
We're seeing more male patients, definitely. I would say some of the most common procedures that we see men for from the standpoint of facial rejuvenation would be eyelids. Men will commonly come in not only for heavy upper eyelids, but for bags in the lower lids. They feel good, they're taking pretty good care of themselves, they diet, exercise, but they look tired all the time. And so eyelid surgery, both upper and lower, is pretty common in males. Men are less likely or less inclined to do maintenance procedures like Botox and fillers. They do it, but they're not as used to the maintenance aspect of taking care of themselves as women are. Women are used to the hair and periodically going for hair and coloring and nails and all that, so they're really right on board with maintenance, whereas men, not so much. But some men do Botox, and I think you have to be careful when you do Botox for men to make sure you don't feminize the brow too much, because you can end up with an odd overarching, which you can correct, but you really don't even want to go there in the first place, so you have to be careful.
There's an art to it. It's artistry.
Yeah, there is, and you have to just be careful when you're treating men not to overdo it. Men take more Botox on average than women because the muscles are heavier, skin is thicker, so they'll need more. But you'd rather undertreat than overtreat. That's generally my philosophy.
There's now laser-assisted liposuction, smart lipo it's known as. Can you tell me a little bit more about that?
It's a technology that we've been using in our practice for about 2 years. If you think about liposuction, there's basically a mechanical, and then there's heat-assisted, if you want to break it down into 2 categories. The mechanical would just be simply manually removing fat with liposuction cannulas. All liposuction has in common the tumescent technique, essentially, which is adding liquid first to the fat. Saline and Novocaine and epinephrine, that's all first injected into the areas to be suctioned. And then the next steps can be purely mechanical, or they can involve some heat technology. And in our particular case, we use laser technology to pre-treat the fat before suctioning. We have a 1 millimeter laser fiber that we put in through the skin, and that helps pre-treat the fat. It softens it up, it liquefies the fat, and it makes it easier to remove with smaller cannulas. So theoretically it's gentler and there's less pain. The other advantage of all of the heat technologies, including laser, would be to add some heat to the skin to help enhance shrinkage, because the ultimate result of liposuction is dependent on how well the skin shrinks to the new contour that you've created. And so you have to be careful about counseling patients about liposuction and making sure that they're appropriate candidates based on their skin quality, because even with the heat technology and the laser that we're using, and the fact that we can get good skin shrinkage with it, some patients you really just need to have a more traditional surgical procedure like a tummy tuck or some skin removed. So you have to really be careful about how you're evaluating patients.
Is liposuction, is that a way to, if you have cellulite, I don't know if I'm saying it right or wrong, is that what the most common use is for that, or?
No, traditional liposuction is really thought to make cellulite potentially worse.
Oh, okay.
Yeah, cellulite is sort of a superficial layer of fat that's protruding into the skin layer, and it's really common in women. It kind of gives that pebbly or cobblestone looking appearance.
I didn't know anything of which you speak.
Yeah, it's particularly problematic for women in thighs and buttock regions. There is a new laser technology available by the same company that makes Smart Lipo that's designed to treat cellulite by basically breaking up all the little septae or fibrous tissue that's causing the irregularities under the skin. So it's not so much about removing fat, but it is about breaking up some of the fibrous irregularities with heat and with laser. It's still relatively new. I can't say for sure that the new laser technology works well, not having personally used it for this indication. Up till now, there's really nothing that treats cellulite well, except having lower body fat.
Diet and exercise again, yeah, lower body fat.
But this new cellulite technology may prove to be useful, but it's just very early. Right now, it's in the zealot phase.
I see.
So you have to be careful. I think what we should go through in plastic surgery is a zealot phase initially where everyone's excited about a new technology, and then carefully we need to go through an assessment phase. Does it really work? Is it safe?
Right.
And then become more pragmatic about its use once we've figured it all out.
Sounds like smart medicine. Sounds good.
Yeah.
Well, I don't think we're getting any other questions at this point, but I also wanted to mention that you also have Accent on Skin?
Yes.
And that is where folks can go for some of those chemical peels that we were talking about, and some consultation on products, and maybe post-surgical treatments. So another nice thing too is Mother's Day is just right around the corner, so
That's right.
I know that they have gift certificates because I was looking on the website. So
Yes.
if you are maybe not ready for laser-assisted liposuction or Botox, maybe a facial is a good place to start, just to venture in, or a chemical peel. So please go to their website. And do you know the website off the top of your head?
For Accent on Skin?
Yes, yes.
I think you can just go right to Fox and Shingo Plastic Surgery.
Okay, and get there.
And get
Okay.
there.
All right, great. And I want to thank Dr. Victor Shingo Jr. so much for being my guest today. And
Thanks for having me.
Seniors Live Web Chat will be back next week with Tim Bartos. Thank you. Thank you.